Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without delay, let's get started.
The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated.
The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals.
4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, which is milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery. A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Baby's sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face.
The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is teaching a class on arterial essential hypertension. Which modifiable risk factors would the nurse include when preparing this presentation? 1. Include information on retinopathy and nephropathy. 2. Discuss sedentary lifestyle and smoking cessation. 3. Include discussions on family history and gender. 4. Provide information on a low-fiber and high-salt diet. The correct answer is 2. Discuss sedentary lifestyle and smoking cessation. Remember to look at the adjectives. The stem of the question is asking about modifiable risk factors. A sedentary lifestyle is discouraged in clients with hypertension. Daily isotonic exercises are recommended. Smoking increases the atherosclerotic process in vessels, causes vasoconstriction of vessels, and adheres to hemoglobin, decreasing oxygen levels. Retinopathy and nephropathy are complications of uncontrolled hypertension, not modifiable risk factors. Family history and gender are non-modifiable risk factors. The question is asking for information on modifiable risk factors. A low-salt diet is recommended because increased salt intake causes water retention, which increases the workload of the heart. A high-fiber diet is recommended because it helps decrease cholesterol levels. Which assessment data best indicates the client with type 1 diabetes is adhering to the medical treatment regimen? 1. The client's fasting blood glucose is 100 milligrams per deciliter. 2. The client's urine specimen has no ketones. 3. The client's glycosylated hemoglobin is 5.8%. 4. The client's glucometer reading is 120 milligrams per deciliter. The correct answer is 3. The client's glycosylated hemoglobin is 5.8%. A glycosylated hemoglobin gives the average of the blood glucose level over the past 3 months and indicates adherence to the medical treatment regimen. A glycosylated hemoglobin level of 5.8% is close to normal and indicates that the client is adhering to the treatment regimen. The fasting blood glucose level is obtained after the client is NPO for 8 hours. This blood result does not indicate adherence to the treatment regimen. If the client has no ketones in the urine, it indicates that the body is not breaking down fat for energy, but it does not indicate adherence to the treatment regimen. A glucometer reading of 120 milligrams per deciliter indicates a normal blood glucose level, but it is a one-time reading and does not indicate adherence to the medical treatment regimen. The nurse administered 12 units of regular insulin to the patient with type 1 diabetes at 0700 hour. Which meal prevents the client from experiencing hypoglycemia? 1. Breakfast. 2. Lunch. 3. Supper. 4. Nighttime snack. The correct answer is 1. Breakfast. Regular insulin peaks in 2 to 4 hours. Therefore, the breakfast meal would prevent the client from developing hypoglycemia. Lunch would cover an 0700-hour dose of insulin isophane, an intermediate-acting insulin. Supper would cover a 1600-hour dose of regular insulin, a short-acting insulin. The nighttime snack would cover a 1600-hour dose of insulin isophane, an intermediate-acting insulin. The client diagnosed with rule-out myocardial infarction is experiencing chest pain while walking to the bathroom. Which action should the nurse implement first? 1. Administer sublingual nitroglycerin. 2. Obtain a stat electrocardiogram. 3. Have the client sit down immediately. 4. Assess the client's vital signs. The correct answer is 3. Have the client sit down immediately. Stopping all activity will decrease the need of the myocardium for oxygen and may help decrease the chest pain. The nurse must assume the chest pain is secondary to decreased oxygen to the myocardium and administer a sublingual nitroglycerin tablet, which is a coronary vasodilator, but this is not the first action. An ECG should be ordered, but it is not the first intervention. Assessment is often the first nursing intervention, but when the client has chest pain and a possible MI, the nurse must first take care of the client. Taking vital signs would not help relieve chest pain. Whenever you want to select an assessment intervention, be sure to think about whether that intervention will help the client, especially if the client is experiencing pain. Do not automatically select the answer option that is assessment.
The nurse is providing postoperative care for a patient who underwent laparoscopic cholecystectomy. What should be reported immediately to the healthcare provider? 1. The patient cannot void 5 hours postoperatively. 2. The patient reports shoulder pain. 3. The patient reports right upper quadrant pain. 4. Output does not equal input for the first few hours. The correct answer is 3. The patient reports right upper quadrant pain. Rationale. Right upper quadrant pain is a sign of hemorrhage or bile leakage. The ability to void should return within 6 hours postoperatively. Right shoulder pain is related to unabsorbed carbon dioxide and will be resolved by placing the patient in a Sims position. For the first several hours after surgery, output is not expected to equal input.
The nurse on the telemetry unit has just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. 2. The client diagnosed with congestive heart failure who has 4+ sacral pitting edema. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 94%. 4. The client with chronic renal failure who has an elevated creatinine level. The correct answer is 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. An S3 heart sound indicates left ventricular failure, and the nurse must assess this client first because it is an emergency situation. The nurse would expect a client with CHF to have sacral edema of 4+. The client with an S3 would be in a more life-threatening situation. A pulse oximeter reading of greater than 93% is considered normal. An elevated creatinine level is expected in a client diagnosed with chronic renal failure.
A nursing student is performing a colostomy irrigation. When would the nurse intervene? 1. Student hangs the prepared irrigation container on the bed rail. 2. The student puts 500 to 1,000 milliliters of lukewarm water in the container. 3. Student cleans, rinses, and dries the skin and applies a new drainage pouch. 4. The student encourages the patient to walk for 30 to 45 minutes for secondary evacuation. The correct answer is 1. Student hangs a prepared irrigation container on the bed rail. Rationale. The nurse will remind the student that the container has to be hung at shoulder level. If the container is too low, the flow will be sluggish. If the container is below the entry site, the solution will flow retrograde. If the container is too high, the solution will flow too quickly and cause cramping. The other actions are correct.
The client is having status epilepticus and is prescribed IV diazepam. The client has an IV of D5W 75 milliliters per hour in the right arm and a saline lock in the left arm. Which intervention should the nurse implement? 1. Dilute the diazepam and administer over 5 minutes via the existing IV. 2. Do not dilute the medication and administer at the port closest to the client. 3. Question the order because diazepam cannot be administered with D5W. 4. Inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. The correct answer is for inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. Rationale. The nurse should administer the diazepam, a benzodiazepine, undiluted through the saline lock. Diazepam is oil-based and should not be diluted. It should not be administered in an existing IV line if another option is available. The nurse does not need to question the order because there is an existing saline lock.
A nurse is assessing a child in relation to the stages of Jean Piaget's theory of cognitive development. Which behavior indicates that the child has reached the formal operation stage of cognitive development according to Piaget? 1. Utilizes deductive reasoning when examining alternatives. 2. Uses logical thought to organize collected information. 3. Investigates objects by placing them in the mouth. 4. Employs language to communicate with others. The correct answer is 1. Utilizes deductive reasoning when examining alternatives. Rationale. Utilizing deductive reasoning to examine alternatives reflects the formal operation stage of cognitive development. These individuals use symbols related to abstract concepts and are capable of hypothetical and deductive reasoning.
The nurse is taking an initial history for a patient seeking surgical treatment for obesity, which findings should be called to the attention of the surgeon. 1. Obesity for approximately 5 years. 2. History of counseling for body dysmorphic disorder. 3. Failure to reduce weight with other forms of therapy. 4. Body weight 100% above the ideal for age, gender, and height. The correct answer is 2. History of counseling for body dysmorphic disorder. Rationale. Body dysmorphic disorder is a preoccupation with an imagined physical defect. Corrective surgery can exacerbate this disorder when the patient continues to feel dissatisfied with the results. The other findings are criterion indicators for this treatment.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? 1. Hamburger, salad, and milkshake. 2. Baked liver, green beans, and coffee. 3. Spaghetti with tomato sauce, salad, and coffee. 4. Fried chicken, green beans, and skim milk. The correct answer is 3. Spaghetti with tomato sauce, salad, and coffee. Rationale. Pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol.
Which question will the nurse ask the student nurse who was assigned to do an enteral feeding for a patient with a small bore feeding tube? 1. Have you evaluated the nutritional status of the patient? 2. Is the patient tolerating the supine position after feedings? 3. Have you had any problems checking the residual? 4. Is the patient developing any problems related to the feedings? The correct answer is 3. Have you had any problems checking the residual? Rationale. A disadvantage of small bore feeding tubes is that they are prone to clogging, and checking for residuals can be difficult. If the tube gets clogged, it may have to be removed and reinserted. Placing the patient in a supine position is incorrect. The head of the bed needs to be elevated 30 degrees to 45 degrees during feedings and for 30 to 60 minutes after the feeding to reduce the risk of aspiration. The nurse is reviewing medication lists for patients who are being treated for peptic ulcer disease. The nurse is most likely to question the use of which medication? 1. Ibuprofen. 2. Omeprazole. 3. Amoxicillin. 4. Clarithromycin. The correct answer is 1. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, and NSAIDs are thought to be one of the aggravating factors of peptic ulcer disease. Omeprazole, amoxicillin, and clarithromycin are used as a triple combination therapy for the treatment of peptic ulcer disease.
Which statement best describes the pharmacodynamics of insulin? 1. Insulin causes the pancreas to secrete glucose into the bloodstream. 2. Insulin is metabolized by the liver and muscle and excreted in the urine. 3. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. 4. Insulin lowers blood glucose by promoting the use of glucose in the body cells. The correct answer is 4. Insulin lowers blood glucose by promoting use of glucose in the body cells. The statement in option 4 explains the pharmacodynamics, which is the drug's mechanism of action or way that insulin is utilized by the body. Over time, elevated glucose levels in the bloodstream can cause long-term complications, including nephropathy, retinopathy, and neuropathy. Insulin lowers blood glucose by promoting the use of glucose in body cells. The pancreas does not secrete glucose. It secretes insulin, which is the key that opens the door to allow glucose to enter the body cells. Glucose enters the body through the gastrointestinal system. The statement in option 2 explains the pharmacokinetics of insulin and how the body metabolizes it and excretes it in urine. Pharmacokinetics is the process of drug movement to achieve drug interaction. Insulin does not maintain colloidal osmotic pressure. Albumin, a product of protein, maintains colloidal osmotic pressure. The client newly diagnosed with type 1 diabetes asks the nurse, "Why should I get an external portable insulin pump?" Which statement is the nurse's best response? 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. 2. Insulin pumps provide an automatic memory of the date and time of the last 24 boluses. 3. The pump injects intermediate-acting insulin automatically into the vein to maintain a normal blood glucose level. 4. The portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. The correct answer is 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. A portable insulin pump is a battery-operated device that uses rapid-acting insulin, Lispro, Humalog, or Novolog. It delivers continuous release of a small amount of insulin and bolus doses with meals. This provides fewer hypoglycemic reactions and better blood glucose levels. The pumps do provide a memory of boluses, but that is not the nurse's best response to explain why a client should get an external portable insulin pump. External portable insulin pumps are only used to deliver rapid-acting insulin subcutaneously. Intermediate and long-acting insulins are not used with an external portable insulin pump because of unpredictable control of blood glucose. The insulin pump is not recommended as the initial way to administer insulin because the success of the insulin pump depends on the client's knowledge and compliance. Initially, most clients start injecting insulin with a syringe and then graduate to the pumps. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? 1. Instruct the client to dial in the number of insulin units needed to inject. 2. Demonstrate the proper way to draw up the insulin in an insulin syringe. 3. Discuss that the insulin pen injector must be used in the abdominal area only. 4. Explain that the traditional insulin syringe is less painful than the injector pen. The correct answer is 1. Instruct the client to dial in the number of insulin units needed to inject. The insulin pen injector resembles a fountain pen. It contains a disposable needle and insulin-filled cartridge. When the client operates the insulin pen, the correct dose is obtained by turning the dial to the number of insulin units needed. The insulin pen injector does not require drawing up insulin in a syringe. The insulin pen injector can be used in any subcutaneous site where traditional insulin can be injected. Most clients state that there is less injection pain associated with the insulin pen than there is with the traditional insulin syringe.
The nurse is caring for a client diagnosed with a hemorrhagic stroke. Which medication should the nurse question administering? 1. Clopidogrel, 2. Mannitol, 3. Nifedipine, 4. Dexamethasone. The correct answer is 1. Clopidogrel. Rationale: the client has experienced a bleed into the cranium. Clopidogrel, an antiplatelet, interferes with the client's clotting ability. This medication should be held and discussed with the HCP. There is no reason to question giving a medication that will decrease intracranial pressure. Mannitol is the diuretic of choice for this client. It is an osmotic diuretic, which has the best effect on the cranial tissues. Nifedipine is a calcium channel blocker that will decrease the client's blood pressure, which is elevated in clients with increased intracranial pressure. Dexamethasone, a glucocorticoid, will decrease edema, resulting in decreased intracranial pressure.
The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? 1. Omeprazole daily. 2. Amoxicillin twice daily. 3. Loratadine daily. 4. Prednisone daily. The correct answer is 1. Omeprazole daily. Omeprazole is a PPI. Up to 90% of adult-onset asthma is the result of gastroesophageal reflux disease. Treating gastric reflux will treat asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective against asthma. Prednisone is a glucocorticoid. Glucocorticoids are prescribed daily for clients with chronic lung diseases, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroid.
The 55-year-old African-American male client presents to the emergency department with blurred vision, slurred speech, and left-sided weakness. The client has a history of hypertension and benign prostatic hypertrophy. Which statement regarding the client's medications should the nurse ask at this time? 1. Have you been taking over the counter herbs to treat the BPH? 2. Do you take an aspirin every day to prevent heart attacks and strokes? 3. Do you eat green, leafy vegetables frequently? 4. Have you been taking medications routinely to control the hypertension? The correct answer is 4. Have you been taking medications routinely to control the hypertension? Rationale. Many medications for hypertension have the adverse effect of causing erectile dysfunction, which many men are hesitant to discuss with their HCP, and a man may simply stop taking the medication to avoid the side effect. The nurse should assess how the client has been controlling his hypertension and ask specifically about erectile dysfunction related to hypertensive medication. Hypertension is a risk factor for developing other cardiovascular diseases, including stroke. This client has 2 risk factors for developing a stroke: hypertension and his racial background. The nurse should ask all clients about taking OTC preparations when being admitted, but this question would have no bearing on the clients presenting symptoms of a stroke. The client has symptoms of a stroke. Whether he was taking an aspirin to prevent a potential problem is irrelevant. The client has a problem at this time. Green, leafy vegetables are high in vitamin K, the antidote for Coumadin. The client has no reason to be taking an anticoagulant at this time.
The nurse is developing a discharge teaching plan for the client diagnosed with congestive heart failure. Which interventions should be included in the plan? Select all that apply. 1. Notify healthcare provider of a weight gain of more than 1 pound in a week. 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside. 3. Instruct client to remove the salt shaker from the dinner table. 4. Encourage client to monitor urine output for change in color to become dark. 5. Discuss the importance of taking the loop diuretic furosemide at bedtime. The correct answers are 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside, and 3. Instruct client to remove the salt shaker from the dinner table. The client should not take digoxin if the radial pulse is less than 60. The client should be on a low-sodium diet to prevent water retention. The client should notify the HCP of weight gain of more than 2 or 3 pounds in 1 day. The color of the urine should not change to a dark color. If anything, it might become lighter, and the amount will increase with diuretics. Instruct the client to take the diuretic in the morning to prevent nocturia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A patient with chronic hepatitis C has been taking a daily dose of the antiviral medication Licensure. So, Fospivir for the past month. Which information is the most important for the nurse to communicate to the healthcare provider? 1. The patient reports mild headaches that come and go. 2. The patient complains of feeling chronically tired. 3. The patient has missed a period and is having unprotected sex. 4. The patient reports nausea and occasional diarrhea. The correct answer is 3. The patient has missed a period and is having unprotected sex. Rationale. During pregnancy, this medication is prescribed with caution and only if clearly needed. The healthcare provider must discuss the risk versus benefits with the patient and then decide to continue or discontinue the medication. Headache, fatigue, nausea, and diarrhea are common adverse effects of Licensure. Sofosbuvir and should be reported if persistent or recurrent.
As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by 1. Antispasmodic effects on the pericardium. 2. Causing an increased myocardial oxygen demand. 3. Vasodilation of peripheral vasculature. 4. Improved conductivity in the myocardium. The correct answer is 3. Vasodilation of peripheral vasculature. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium.
Which is the primary purpose of the American Nurses Association Standards of Clinical Nursing Practice? 1. Define the philosophy of nursing practice. 2. Establish criteria for quality nursing practice. 3. Identify the legal definition of nursing practice. 4. Determine educational standards for nursing practice. The correct answer is 2. Establish criteria for quality nursing practice. The American Nurses Association Standards of Clinical Nursing Practice describe the nature and scope of nursing practice and the responsibilities for which nurses are accountable. A philosophy incorporates the values and beliefs about the phenomena of concern to a discipline. The American Nurses Association Standards of Clinical Nursing Practice reflect, not define, a philosophy of nursing. Each nurse and nursing organization should define its own philosophy of nursing. The laws of each state define the practice of nursing within the state. Educational standards are established by accrediting bodies, such as the National League for Nursing Accrediting Commission, the Commission on Collegiate Nursing Education, and state education departments. A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other clients in the dining room." Which legal term is related to this statement? 1. Battery. 2. Assault. 3. Negligence. 4. Malpractice. The correct answer is 2. Assault. The statement in option 2 is an unjust threat. Assault is the threat to harm another person without cause. The statement in option 1 is not an example of battery. Battery is the actual willful touching of another person that may or may not cause harm. The statement in option 3 is not an example of negligence. Negligence occurs when harm or injury is caused by an act of either commission or omission. The statement in option 4 is not an example of malpractice. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the client and nurse.
A client is afraid of receiving vitamin B12 injections because of potential toxic reactions. Which is the nurse's best response to relieve these fears? 1. Vitamin B12 will cause ringing in the ears before a toxic level is reached. 2. Vitamin B12 may cause a very mild rash initially. 3. Vitamin B12 causes mild nausea, but nothing toxic. 4. Vitamin B12 is generally free of toxicity because it is water-soluble. The correct answer is 4. Vitamin B12 is a water-soluble vitamin. When water-soluble vitamins are taken in excess of the body's needs, they are filtered through the kidneys and excreted. Vitamin B12 is considered to be non-toxic. Adverse reactions that have occurred are believed to be related to impurities or to preservative in B12 preparations. Ringing in the ears, rash, and nausea are not considered to be related to vitamin B12 administration.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.